Hi everyone, this is Mr. Neil Writer, consultant audiologist and director of ClearWax. I have a very interesting video here. It's taken using both our recently developed WAXscope and also our wireless iClearScope endoscope, which we launched back in 2015. So the WAXscope, which is what we're using now, it incorporates a speculum attachment, and here I'm using our smallest of the 4 speculum sizes, and you'll realise why. This patient's got a very narrow and also a bit bendy ear canal, so we're using the smallest one just to dilate the ear canal. And the reason for developing the WAXscope is that with our endoscope, the iClearScope, although, and you'll see the difference in view at the end of this video, you cannot compete with an endoscope when it comes to optics, the field of view with inside the ear canal. However, with an endoscope, it is sometimes difficult for some specialists to use. They find it difficult to hold the endoscope in one hand and with the other hand using an instrument and then having to navigate and open up a narrow twisty ear canal. So this is the view that you'll normally see from more like an ENT microscope. And so it's a more narrowed view, but it's very magnified, as you can see. And what we're doing here, I've just cleared the blockage near the entrance. Now, this patient is a hearing aid wearer, and they've been finding that the dome and wax filter is getting blocked, and they're getting a bit of acoustic feedback. So what I'm trying to do here is just to remove as much of residual wax near the entrance as possible. Although the blockage is clear, and you'll see the eardrum in a moment, I just want to remove as much debris as possible. Now, we're just dilating the ear canal here, and I've just changed the focus, and you can see the eardrum, and we're just going to... So although the view of the eardrum is very magnified and very clear, you're seeing a bit of an eardrum at the time. And this is what a microscope's like. This is what most people... This is more to the other viewers, the non-earwax removal specialists who are not aware of the difference between what's normally used to remove earwax, which is either loupes or goggles or a microscope, compared to the endoscope. And an endoscope, I would say in the UK, it's still probably 5 to 10% of specialists in the UK use an endoscope. Otherwise, they're using some form of visualization technique that uses a speculum like this. And just by virtue of the fact you're using a speculum, you are going to get a narrow field of view. But I generally feel this WAXscope is the next best alternative to the endoscope. So for any specialist out there who's watching this video who struggles using an endoscope or feels that they will struggle with an endoscope and they're struggling with their current visualization technique, whether it be loupes or an otoscope or a microscope, this is, for me, by far the next best alternative. You can just see that magnification, and what's great about the WAXscope is you can see we're using different instruments as well. We're able to utilize all ENT instruments, not just suction. And in a minute, I'm going to, as I said, switch to the endoscope. And first of all, just to give you a perspective of the difference, but also you'll see more clearly how narrow the patient's ear canal entrance is. So again, look at this. There's an amazing view of the Jobson horn here that we're using. And we're just gently, just slowly scooping some of this soft wax, which may block the dome because the client's entrance is slightly narrow. It's probably slightly inflamed as well. You can see here, that's the entrance of the ear canal. And I'm just finishing up with the Jobson horn. So the view's different. It's a much wider field of view with an endoscope. But I would say the magnification, of course, is more striking with the WAXscope. But that just gives you a perspective of that same patient's ear canal entrance. I've just stretched it open, and there's the eardrum. Well, I hope you enjoyed that video, guys, and it gives you some perspective on the different optics that are currently used for ear care. And that's so if you're not a clinical ear care specialist, and if you are a clinical ear care specialist and you're interested in either the iClearScope, endoscope, because we're still manufacturing and training people on the endoscope, or the WAXscope, please do email info@clearwax.co.uk. Thank you.